Hi, it's Jill Osborne from the IC Network, and I'm here in my office with another self-help tip on living with IC and bladder pain syndrome. Wanted to take a moment and talk about the barriers that patients face in getting a prompt diagnosis, because if you're like most patients, you've probably seen several doctors, and you're probably at this point in time pretty frustrated. So let me see if I can explain why and give you some tips that will help you work more effectively with your doctors. So the first issue that you've got to deal with is the fact that there are many names used to describe bladder symptoms of frequency urgency pressure. For example, some of you have been diagnosed with urethral syndrome or urethritis. Some of you have been diagnosed with trichinitis. Some of you may have been diagnosed with a sensitive bladder. Some of you may have been diagnosed with honeymoon cystitis, interstitial cystitis, or if you're a man, you've probably been diagnosed with prostatitis. So issue number one is there are a lot of different terms used to describe this specific set of symptoms, and we're working hard now to try to create some consistency in the medical community so patients don't get so confused by these diagnoses. The other thing you have to accept is that there are doctors who have different belief structures and different ways of interpreting your symptoms. So for example, if you go to an emergency room, they may just assume that you've got a really bad bladder infection, send you on your way with antibiotics and some pain meds, even if you don't have culture results back. If you go to a gynecologist might not look at the bladder as the source of the pain. They may focus more on the reproductive system. And in fact, we have had some cases where IC patients have had mistaken hysterectomies only to discover after the fact that their problem wasn't with the reproductive system, it was actually with the bladder. A family doctor might just say you have a sensitive bladder. It really takes somebody knowledgeable about IC, such as a urologist or a urogynecologist, to start making a good diagnostic, accurate effort. So that's important for you to know. Now, the other issue, of course, that we have to deal with is that there are some doctors who just don't believe in IC anyway, and I have a very good example of that. There was a patient who moved to the West Coast, and she had been diagnosed with a fairly severe case of IC by a well-known urologist on the East Coast. And she even had a video showing her bladder covered with wounds. And yet, when she walked into this new doctor's office, was, still with very severe symptoms, and clearly she was asking for help, her doctor said, "Oh, I've got great news for you. You don't have interstitial cystitis." And she was ecstatic. She was so happy about that. And she went on her merry way, and a couple of days later, she called me and went, "I'm really confused. I've got some doctors diagnosing me with IC, but now this doctor says I don't have IC." And my response back to her was, "Do you have symptoms?" And she goes, "Yeah." "Well, did the doctor give you new treatments?" He went, "No." And she went, "No." And it turned out that the doctor that she had seen on the West Coast, that I will not name, was actually well known for not even believing that IC was real. And so, what I said to her is, listen, don't get hung up on the name. The point is that you've got symptoms and you need help for those symptoms. So go back to the doctor and say, okay, what are we going to do to improve my sleep quality? What are we going to do to reduce my frequency so that I can work effectively throughout the day? So it's really important that you not get hung up on the names. That's critical. Now, another barrier that we IC patients face is being able to talk about our symptoms. Number one, it's embarrassing. You don't want to talk about it. I mean, come on. How embarrassing could it be to walk in and say, "Doctor, it hurts when I urinate"? You know what? That's exactly what you have to do. The worst mistake that you can make when you walk into a doctor's office is to not be clear about your symptoms. So be specific. Hopefully do a voiding diary so that you can talk about the behavior of your bladder. How many times do you urinate at night? How many times on average do you get up during the day? When are your symptoms the worst? In the morning, in the afternoon, in the evening? Are your symptoms associated at all with food? These are critical points that your doctor needs to hear from you. So the worst thing you can do is walk into your doctor's office and say, it hurts down there. I mean, what does that mean? That doesn't mean much. That's not good information. But if you can walk into your doctor's office and say, okay, doc, for the last 4 months, I have been unable to sleep through the night. I get up on average 3 or 4 times a night. Sitting in the car is uncomfortable and I can't drink my normal foods or eat my normal foods. That's giving your doctor a clue. And that's really important in the diagnostic process, because a diagnosis is really based upon your symptoms. And what makes a diagnosis of IC very unique is usually IC patients have pain as their bladder fills with urine that is relieved after urination. Now, there are some patients who have pain not before urination, but after urination. And those patients may actually instead have some bladder spasms or some pelvic floor. But, just you pay attention to your pain, track the patterns of the pain. And listen, you don't have to have pain to have a diagnosis of IC. If you just have frequency urgency, that's fantastic news. But that's still important and still needs treatment.